Okay, so the next topic is on gingival bleeding. One of the most common complaint that a periodontal patient comes to us is due to gingival bleeding. The patient may notice bleeding while brushing their teeth or while having some food. They may notice gingival bleeding. So this is the only what a clinical aid, diagnostic aid that helps to know for the patient to know that he or she is having some problem with the gum disease, because the rest of the diseases we know, the rest of the say for example for caries and all that, it is mostly symptomatic. So there will be pain, there will be what probing sharp type of pain with which he or she can know that there is caries or something. But mostly the periodontal disease usually get unnoticed. So the only reason, the only sign that is the patient get noticed is of gingival bleeding. Okay, so this class, what session will be on bleeding. What are the causes of it? Most of you must be knowing what are the causes of it. Now, what are the clinical parameters by which we can check the gingival bleeding, and also what is the significance of gingival bleeding? Okay, so as we know that the clinical features of gingivitis may be characterized by red and sponginess of the gingival tissue, bleeding on provocation, changes in the contour, presence of calculus or plaque with no radiographic evidence of crust and bone loss. Okay, so the redness and sponginess of gingival tissues, that can be also the patient may notice. But bleeding on provocation, anywhere when there is bleeding, the patients or normally everyone used to get what provoked that something is happening, right? If you cut your hand and if it is bleeding, then we will be very much worried why it is so much. If it is the bleeding is not stopping soon, we will be worried much. So just like that, when there is gingival bleeding, the patient can notice that something wrong is going on, and with that the patient can come to the clinician. Now, the others are also the changes that are seen in the gingivitis. Now, some of these changes are proceeded along with the gingivitis too, when they reached up to the stage of periodontitis too. Now, gingival bleeding, it is considered to be one of the earliest signs of gingival inflammation. Okay, so we know that the advanced case, the situation of gingival inflammation is the periodontitis. So the earliest sign of gingival inflammation is gingival bleeding. Now, it is more objective than the visual signs of gingivitis like redness or swelling, which we have to see. Or this, the patient itself can notice that the patient is having the bleeding. So it is more objective type of complaint the patient tells. Now, and also it is easily recognized by the patient. Okay. Now, when coming to histology, why there is gingival bleeding? So, as we know that when there is what local factors or some other systemic add-on factors with the local factors, we have what post-immune response, and there is a constant disruption in the homeostasis, and a lot of post-response is happening. So what is the net result of it? The net result of it is the alterations or disruption of the blood vessel walls that is seen in the soft tissue wall. And there is dilation of the blood vessels. Why there is dilation? Because firstly, there is a lot of oozing of GCF, and there is a lot of post response that is taking place at the gingival sulcus. So for that, there is more oozing of the gingival crevicular fluid too. So for that, there is from where does the gingival crevicular fluid comes? It comes from the gingival tissues. Okay, so that is by the dilation of the blood vessels. Now, also there is loss or decrease of supporting perivascular collagen. Loss or decrease in the supporting perivascular collagen. So overall, the tissue will become very friable and very like something like a micro ulceration is seen in the sulcular epithelium or in the clavicular epithelium. Okay, now, what are the main causes? What are the main causes of gingival bleeding? Mainly, we can classify gingival bleeding according to the reasons, that is by the local factors, and the gingival bleeding that is caused by systemic changes. Now, local factors as such of causing gingival bleeding is rare, but local factors, retenting factors, that is plaque retenting factors. For example, if you have a high attached frenum, or if you have gingival recession that is beyond the mucogingival junction, or if you have a margin of the crown which is over contour, for which it is acting as a plaque retenting factors, or some anatomical factors like cemental enamel pores and all, which is enhancing the plaque retentive factors, will cause this local factors to enhance, and thereby there is more and more inflammation that is occurring. Okay, now there are also some reasons for acute gingival bleeding. The reason for acute gingival bleeding, that is acute, like injury. If there is any injury to the gingiva, there is acute gingival bleeding. And also there is a spontaneous bleeding, spontaneous type of bleeding that is seen in ANAC. ANAC means acute necrotizing ulcerative gingivitis. In this type of gingivitis, we see a spontaneous type of gingivitis, merely just opening the mouth itself, the patient can have bleeding. So that is a spontaneous type of bleeding that is seen. Now, what are the causes of systemic changes? Systemic changes, we know that if the patient is having hemorrhagic diseases, or hemophilia, like, or bleeding disorders, or the patient is having any platelet disorders, thrombocytopenic purpura, or the patient can have systemic conditions like pregnancy and all, there is more chances of bleeding. Okay, there is definitely the other changes, that is for a pregnancy tumor like that, all are there, but gingival bleeding is also more there. That is mainly due to the hormonal changes. So the hormonal changes has these hormones have also a role in the gingival bleeding. Also, the patient is, if having any hormonal or this balance, again the patient can have gingival bleeding. Okay, and also some endocrine disorders like diabetes itself can cause bleeding because it, in a way, it is related with the collagen synthesis and what the disruption in the balance between the, as we know that in diabetes there is age factors, there is more of age factors, that is the good collagen is not formed, but the bad collagen still exists, and all this will disrupt the balance, which in turn will inhibit the wound healing, which will in turn will delay the wound healing. Okay, so that for these patients also there is increased type of bleeding. Now, the another reason for the systemic changes that occurs is due to some medications the patients are taking. Like, for example, some anticonvulsants, some calcium channel blockers, some antihypertensive drugs. Though these drugs has an action of the systemic role, these drugs in turn is having an action on gingival bleeding also. So these are the major causes of gingival bleeding. Okay. Now, next is how can we diagnose the gingival bleeding? The gingival bleeding can occur spontaneously, or it can be elicited by flossing or the use of toothpicks, or by probing. Okay, so generally, when we have to evaluate the gingival condition, we generally use a periodontal probe. Okay, so periodontal probe, as we know that its end is blunt. Not like a shepherd hook, so which is having the action of an exploration. Here it is having a blunt end, so that it won't injure more in the clavicular epithelium. Now, coming to various gingival bleeding indices, which are the common gingival bleeding indices. Why we require bleeding indices? Now, one person can say that, okay, the patient or I am having so much of bleeding. The other person can say it is not that much. So, in order to standardize that, what our assessment, we have to stick on to the indices. So, indices actually helps to standardize the what scenario that we are observing or we are seeing. So what are the uses of bleeding indices? It helps to measure the prevalence of periodontal diseases in epidemiological surveys. It helps to measure the effectiveness of anti-plaque and anti-gingivitis agents. And it helps to compare the efficacies of various therapies for periodontal diseases. It also helps the patient screening and monitoring in clinical practices. So it's help in this patient screen, whether patient is may say that he or she is doing 2 or 3 times, but that doesn't make it is effective. So in order to know that whether it is an effective type of oral hygiene methods the patient is following, we can go for this screening of through the gingival indices, bleeding indices, and we can assess whether the patient has to stick on to the routine or whether any changes has to occur. So, and it also helps for the patient motivation. Now, what are the methods by which are the indices that is used as a gingival bleeding indices? So either the gingival bleeding indices is used as a part of the particular indices, like in papillary marginal assessment, papillary marginal indexes by Mulliman and Mazur. In gingival indices like low and sinless, which is the most common gingival index that we are following. Now, and also for sulcus bleeding index like Mulliman and Son in 1971, and CPI-TN and its modifications. So for this is not the main purpose. The main, like in gingival indices, they also assess the gingival inflammations. But there are some other indices which is purely for gingival, for the assessment of gingival bleeding. Okay, but for these gingival indices, it is just a part of the indices. Okay, now which are the indices that is coming solely for the gingival bleeding indexes? That is about six of them. That is the bleeding point index, the Lennox and Kopsky in 1973, gingival bleeding score by Carter and Barnes in 1974, papillary bleeding index by Mulliman in 1977, then Eastman interdental bleeding index by Brahms, Caton and Paulson in 1984, and modified sulcus bleeding index by Mombili et al. In 1987. So these are the more of a approved gingival bleeding indices that we follow, and of this modified sulcus bleeding indices by Mombili is a frequent gingival bleeding index method that we use. So not going for in detail with each and every indices, but 2 or 3 will be explaining in detail. Okay, so the gingival bleeding indices can be, the evaluation can be done by a dichomatous evaluation or by a graded response. Okay, just like a score. So dichomatous means whether there is bleeding or not. So it is a yes or no type of questionnaire. So it measures only the presence or absence of bleeding. They are not actually grading the the severity of the bleeding at all. So which are the those type of indices? It is bleeding points index, gingival bleeding score, gingival bleeding index, Eastman interdental bleeding index. Okay, so graded response means there is something like a scoring. For this, the bleeding can be evaluated either immediately after the probing and within the specified period of time, like they tend to wait for 30 seconds and then do the evaluation. So by which we can grade within the 30 seconds, there is what is the bleeding status in that quadrant or at that site. Okay, so the use of periodontal probe is the most commonly employed method for bleeding on probing. As I mentioned before, it is due to its blunt end. It causes decreased ulceration of the clavicular epithelium, which is already what ulcerated due to the inflammation. Now, two methods have been suggested regarding the use of the probe. How can we use the probe? Okay, the probe can be inserted just beneath the tip of the distal papilla and gently move along the marginal gingiva towards the nasal side. That is in the gingival bleeding index. Or the probe is inserted to the base of the sulcus until the resistance is felt. And this method, however, can cause a false positive result. So in the first method, it may not reach up to the depth to pass to the nasal side, but in the second method, it has to reach up to the depth. But as we know that the apical portion, it is of much ulceration, so there is more chance for the tissue to be aparted. So this first method is generally what suggested, that is by from the distal to the marginal area, marginal gingiva to the mesial side. Okay, so what is a normal probing force? Just like a normal probing force, that is 0.25 newtons has been suggested for the normal probing. Okay, for this, maybe a sweeping type of action is also preferred than running or walking around the tooth. Now, first coming, not going in detail with all the indices, but one of the indices is papillary bleeding indices by Mulliman in 1977. So in this, the scoring is like 0 means there is no bleeding, 1 means there is single bleeding point, that is 20 to 30 seconds after the probing. Then 2 means there is fine line of blood or several bleeding points. And 3 means blood fills in the interdental triangle soon after the probe. And 4 means immediate profuse bleeding, which fills the interdental area and flows over the tooth and gingiva. So this is Mulliman 1977. Now next is modified sulcus bleeding index by Mombili et al. In 1987. So this is what a method that is used frequently. So here the score 0 means no bleeding when a periodontal probe is passed along the gingival margin, and 1 means isolated bleeding spots are visible, and 2 means blood forms a confluent red line on the margin, and 3 means a profuse or heavy bleeding is seen at that region. So that is modified sulcus bleeding index by Mombili in 1987. Now, one more going in detail is bleeding points index by Lennox and Kopsky in 1973. So it is developed to assess the patient's oral hygiene performance, how well the patient is maintaining, and also to determine the presence or absence of gingival bleeding interproximally and on the facial and the lingual surface of the each tooth. So here also the periodontal probe is drawn horizontally through the gingival crevice of a quadrant, and the gingiva is examined after 30 seconds. Just like the way in which we assess the gingival index. Now, the gingival bleeding index and Eastman interdental index evaluate the presence or absence. So it is something like a dichomatous type of assessment that is only in the interproximal areas. And the gingival bleeding index advocates the use of dental floss to elicit the bleeding, whereas Eastman interdental bleeding index suggests a triangular toothpick made of soft, pliable wood. So these are the two methods by which they assess it. How the bleeding they are assessing, they are mentioning. So first method, GBI, in GBI they use the dental floss, and the second method, they suggest a soft, pliable wood triangular pick which they are assessing. Here they are not assessing with the periodontal probe. Okay, so what is the significance of gingival bleeding? Now, as we know that it is the earliest sign of periodontal disease activity. Now, when we say that it is earliest sign, that means the first area in which you should, regular pattern, the first area with which the bleeding starts is the interdental papilla. Okay, so if there is in the interdental papilla, if there is bleeding, that means the periodontal disease condition is progressing. Now we have to assess whether it has pertained to gingivitis or whether it has advanced to periodontitis. Okay. Now, also after doing the periodontal therapy, we have something known as supportive periodontal therapy. Now, when the patient is recalled according to the Murren's classification, we have recalled say for 3 or 6 or 1 year, we will do some recall assessments that are like gingival bleeding assessment, pocket marking, mobility assessment, occlusal correction, like that we will do. So for these, when we check for the gingival bleeding, if there is gingival bleeding at certain site, that means the disease activity is progressing. So we have to know these sites with the gingival bleeding. We have to do our motivation or tell the patient that these areas has to be addressed immediately, and it has to be noted on the charting. So this, when we tell like an advanced, we have a very set of arrays of diagnostic aids. You have clinical aids, you have microbiological, then you have the biochemical aids and all. For this, if we use when we see the clinical aids, this still is considered to be an clinical aid. Okay, this assessment of gingival bleeding is considered to be a clinical aid. So if there is gingival bleeding at an area, there is a disease activity that is happening over there. You don't need any advanced diagnostic aid to know that this area is having disease or not. Just by doing sweeping action of the periodontal probe, or by the assessment by gingival bleeding indices, we can know that this area is having disease activity or not. So that is the significance of gingival bleeding. So gingival bleeding as such, we or the patient don't need to get panic, but they have to note that this site is on the disease activity. Okay, and we have to know what is the cause of it, why we have the gingival bleeding. For many people, if it is not to the local factors, it may be due to the systemic factors. We have to find out what is the reason for the systemic factors that is involving. Maybe this is the reason with which they even find out that they will be having some hormonal issues or some other issues. Okay, so that is like like a biomarker too. So that is about gingival bleeding.